see today's question. A 30-year-old man presents to physician for a routine physical. On questioning, he comments that his father was diagnosed with colon cancer at the age of 45 years. The patient never had polyps, does not suffer diarrhea, constipation, or bloody stool. So at present, the patient is absolutely asymptomatic, but there is a family history of colon cancer, which was diagnosed for his father at 45 years of age. The patient is nervous about screening and wants to delay as long as possible. According to current recommendations, when should he have his first colonoscopy? So, here are certain recommendations for the colonoscopy screening for detecting colon cancer, especially when there is a family history or even otherwise. So, the screening questions often come in EMREE exam. So, you have to understand when you have to start screening. So the recommendation is if there is no family history in a normal population, the screening starts at 50 years of age. But if there is a family history in first degree relative or multiple second degree relative, then you start screening at 40 years of age, that is 10 years earlier. And you are repeating the colonoscopy every 10 years. Okay, every 10 years. Now there is another catch here. It is at 40 years or 10 years earlier, 10 years earlier than the age of diagnosis for the closest family member. So for his father, it was diagnosed at 45. So 10 years earlier means at 35 years of old or 40 years, whichever is earlier. So here earlier is 35 years. So in this case, in this patient, you have to start screening at 35 years. In general population at 50 years, if there is family history at 40 years or 10 years earlier than the age of diagnosis for the family member. So this is the criteria of diagnosing and screening colon cancer in patients using colonoscopy, and it is repeated every 10 years.